In the previous video, we learned about pemphigus. In this lecture, another rare autoimmune skin disorder, scleroderma, is presented. Scleroderma, also known as systemic sclerosis, is a rare chronic autoimmune disease characterized by the hardening and tightening of the skin and connective tissues. The condition can affect not only the skin but also internal organs, leading to significant complications and morbidity. Scleroderma is part of a group of conditions known as connective tissue diseases and varies widely in severity and manifestations. Understanding the types, causes, symptoms, diagnosis, and treatment of scleroderma is crucial for effective management of this complex condition. Scleroderma is generally classified into two main types: localized scleroderma and systemic sclerosis. Localized scleroderma is limited to the skin and underlying tissues and does not affect internal organs. It is generally less severe than systemic sclerosis and often occurs in children. There are two subtypes of localized scleroderma, which are morphea, characterized by oval thickened patches of skin that are discolored and shiny. These patches can vary in size and may cause deformity if they affect deeper tissues. The second subtype is linear scleroderma. This subtype presents as a line or band of thickened skin, often on the arms, legs, or forehead. When it affects the forehead, it is sometimes referred to as en-coup de sabre. The second type of scleroderma is systemic sclerosis, which is a more severe form of scleroderma that is characterized by widespread skin involvement and can affect internal organs such as the lungs, heart, kidneys, and gastrointestinal tract. The subtypes of systemic sclerosis include limited cutaneous systemic sclerosis and diffuse cutaneous systemic sclerosis. In limited cutaneous systemic sclerosis, skin thickening is primarily limited to the hands, face, and forearms. This subtype is associated with condition known as CREST syndrome, comprising of calcinosis, Raynaud's phenomenon, esophageal dysfunction, sclerodactyly, and telangiectasia. Whereas diffuse cutaneous systemic sclerosis involves more widespread skin thickening, including the trunk and upper arms and legs. It is associated with a higher risk of internal organ involvement and more severe complications. Now, what causes this disease? Scleroderma is an autoimmune disease, meaning the immune system mistakenly attacks the body's own tissues. The exact cause of scleroderma is unknown, but it is believed to result from a combination of genetic, environmental, and immunological factors. There are some key factors involved in the development of scleroderma, like certain genetic markers have been associated with an increased risk of developing scleroderma, suggesting a hereditary component. Exposure to certain environmental factors such as silica dust, organic solvents, or viral infections may trigger the onset of scleroderma in genetically predisposed individuals. In scleroderma, the immune system produces autoantibodies that target the body's own tissues, leading to inflammation and excessive production of collagen. This overproduction of collagen causes the skin and connective tissues to harden and thicken. Scleroderma also involves abnormalities in the blood vessels, leading to reduced blood flow and contributing to the damage of tissues and organs. The symptoms of scleroderma vary widely depending on the type and severity of the disease. However, common signs and symptoms include skin symptoms. The hallmark of scleroderma is the thickening and hardening of the skin, which can cause the skin to feel tight, shiny, and leathery. In severe cases, this can lead to decreased mobility of the fingers, hands, and other joints. Raynaud's phenomena is found in scleroderma. This condition is characterized by episodes of reduced blood flow to the fingers and toes, causing them to turn white or blue in response to cold or stress. Raynaud's phenomenon is often one of the earliest signs of scleroderma. Telangiectasia is present. These are small dilated blood vessels that appear as red spots on the skin, particularly on the face and hands. Calcinosis, which is marked by the deposition of calcium in the skin and soft tissues, leading to the formation of hard, painful nodules. Also, ulcers are formed. Painful sores can develop on the fingers, particularly in those with severe Raynaud's phenomenon or advanced skin tightening. Musculoskeletal symptoms. These comprises joint pain and stiffness. The skin tightening can lead to joint contractures, causing pain and limited movement. Muscle involvement can lead to weakness and a reduction in physical function. Gastrointestinal symptoms occur due to esophageal dysfunction. Scleroderma can cause the esophagus to lose its ability to move food efficiently, leading to difficulty swallowing, acid reflux, and heartburn. Involvement of the intestines can lead to symptoms such as bloating, constipation, diarrhea, and malabsorption of nutrients. Pulmonary symptoms arises due to pulmonary fibrosis. The development of scar tissue in the lungs can lead to shortness of breath, dry cough, and reduced exercise tolerance. Pulmonary arterial hypertension involves increased blood pressure in the pulmonary arteries, leading to symptoms such as shortness of breath, fatigue, and chest pain. Heart involvement in scleroderma leads to arrhythmias, pericarditis, and heart failure. Scleroderma renal crisis, a potentially life-threatening complication characterized by a sudden increase in blood pressure and rapid kidney failure. It is more common in those with diffuse cutaneous systemic sclerosis. Diagnosing scleroderma involves a combination of clinical evaluation, laboratory tests, and imaging studies. A thorough physical examination is conducted to assess skin changes, joint involvement, and signs of internal organ involvement. The presence of Raynaud's phenomenon, telangiectasia, and calcinosis can provide important diagnostic clues. Laboratory tests include autoantibody testing. Blood tests are performed to detect specific autoantibodies commonly associated with scleroderma, such as anti-nuclear antibodies, anti-centromere antibodies, and anti-SCL70 antibodies associated with diffuse cutaneous systemic sclerosis. Other blood tests may be performed to assess kidney function, liver enzymes, and markers of inflammation. Imaging studies. An echocardiogram may be performed to evaluate heart function and detect pulmonary arterial hypertension. Pulmonary function tests assess lung function and help detect pulmonary fibrosis. A CT scan of the chest can reveal lung fibrosis or other abnormalities. In some cases, a skin biopsy may be performed to confirm the diagnosis by examining the tissue under a microscope. Treatment and management. There is no cure for scleroderma, and treatment is focused on managing symptoms, preventing complications, and improving patients' quality of life. Treatment strategies are individualized based on the type and severity of the disease and organs affected. Number 1, medications. Immunosuppressive agents such as methotrexate and cyclophosphamide may be used to suppress the immune system and slow disease progression. Corticosteroids may be prescribed to reduce inflammation, although their use is often limited due to potential side effects, especially in those at risk for scleroderma renal crisis. Calcium channel blockers like nifedipine or amlodipine are commonly used to manage Raynaud's phenomenon by improving blood flow to extremities. Proton pump inhibitors are used to manage acid reflux and esophageal symptoms by reducing stomach acid production. Endothelin receptor antagonists and phosphodiesterase 5 inhibitors are used to treat pulmonary arterial hypertension by relaxing blood vessels and improving blood flow in the lungs. Physical and occupational therapy. Physical therapy can help maintain joint mobility and reduce the risk of contractures. Stretching exercises are particularly important for the hands and fingers. Occupational therapy may involve the use of splints or other devices to improve hand function and assist with daily activities. Lifestyle modifications. Regular moisturizing can help manage dry skin and prevent cracking. Avoiding extreme temperatures and protecting the skin from injury are also important. A balanced diet, possibly with the assistance of a dietitian, can help manage gastrointestinal symptoms and prevent malnutrition. Smoking can exacerbate vascular symptoms and should be avoided. Surgical interventions. In severe cases of Raynaud's phenomenon, a surgical procedure known as digital sympathectomy may be performed to improve blood flow to the fingers. Lung transplant in cases of severe pulmonary dysfunction is also indicated. Thank you for listening. If you like the video, make sure to drop a like. Let me know if you have any suggestions in the comments below. Recently, I have published a book on General Pathology Lecture Notes. It will be greatly beneficial for students wanting to quickly revise basic concepts of general pathology.